Hi,
Hi,
Dr.
Dr.
Friends.
Friends. Please like, comment, subscribe, and enable notifications. We say this during games, but psychiatry is about general appearance. Actually, our consultations start the moment patients walk in. Their gait or facial expressions are things we notice. While internal medicine might rely on blood tests or trace, we focus on verbal and non-verbal expressions. So, Dr. Nakjun, do you have any professional habits or quirks as an ENT doctor you can share?
Nostrils.
I look at noses a lot, and when I see someone picking their ears,
Is it uncomfortable?
I even mentioned it on the subway once because someone was picking their ears, explaining it could lead to infection.
Hyrie gets frustrated.
Even now, aren't you picking your ears?
There's always ear picking. She sometimes asks if I hid the ear pick. Isn't that delusional?
That's concerning.
She asks, did you hide it?
Infections could happen.
My ophthalmologist friend says he looks at patients' eyes a lot, and in my case, due to my job, I tend to look at people's wrists.
For self-harm.
Right? So, from the moment a patient comes in, the consultation starts, I check for any signs of self-harm, and rather than those who openly show them, I notice people with long bandages or patches, or those who are long sleeve and those who wear hot summers, or come with bandages.
Oh, so they tend to hide it from others, right?
Because I need to check for that too, to see if maybe that person is self-harming. They might disclose it themselves, but they might not. It's one of the very important symptoms we address in psychiatry.
It might be a difficult question, but when you talk to those who self-harm, do you find out why they do it? Is it really because they want to commit suicide? Or is it for some other form of relief?
Actually, there are cases where self-harm is due to suicidal thoughts and impulses, but most self-harm isn't life-threatening. Many people cut their wrists with a cutter or scratch with a ruler, but when asked, most say they don't really. Why?
When you ask them why, what do they say?
They often say they don't know, but as we delve deeper in interviews, they mention feeling a bit more at ease after doing it.
Do they think it brings relief?
They say it temporarily eases their depression and pain. Depression can cause depersonalization or feelings of unreality, which is known as depersonalization.
You not myself.
Yes, and
It feels quite unreal.
I feel detached, like my body isn't mine and senses dull,
Like a movie.
right? Like an observer. Depression shows these, but self-harm feels alive.
It creates feeling.
Pain is real.
And some people say it provides intense stimulation in a very lethargic life. Some use self-harm as a form of communication. I'm struggling. I'm this much in pain. Please understand. It's that much of a struggle. I'm struggling. Please help me. When you can't even say it, or even if you do but no one seems to care, people sometimes resort to self-harm as a form of attention-getting. In psychiatry, we have a saying that whatever the patient says is always right. This doesn't mean self-harm is right, but that the patient's actions have their own significance.
There's a reason.
To outsiders, it might seem very irrational, like why do that? But inside the patient, it's seen as almost the best way to escape their current situation. It's an extremely tough situation, a last resort, and they might be trying to overcome their struggles through self-harm. Nowadays, especially, many people post their self-harm on social media.
Oh, on social media. Then seeing that, others might feel the impulse to.
Some people
Influence.
say they've tried it out of curiosity, and through what we call peer pressure, they might feel a sense of belonging and camaraderie. It seems like teenagers don't really have an appropriate way to release these negative emotions. What options do they have?
Have you actually seen any teenage patients like this?
Yes, when psychiatrists meet these days, it seems like there are more of them. If a family or child, how would you react to self-harm? Usually patients don't come to the hospital on their own. Parents often discover it and bring them in. That's mostly the case with teenagers.
First, I'd treat the injury and probably go straight to the hospital.
I'd also treat the wound and check if they're okay elsewhere. I'd let them know they can talk anytime and arrange for them to meet with a psychiatrist for deeper discussions.
You need to persuade them to go to the hospital, as they often resist. Parents tend to cry a lot and get emotional when they see this.
If I saw my child do that, I'd be sad.
Parents often get upset, scold, or even hit. They need to stay calm because it might make the child hide it more. It's important to know since when this behavior started and when the thoughts began. If parents react harshly or overreact, children might hide it saying they won't do it again but continue secretly. So, even though it's tough, staying calm is crucial. Some say, you won't die, so stop.
That's just anger, right?
Saying things like, if you're gonna do it right, is absolutely not okay. Also, saying, tell me what you want, I'll do anything, just don't self-harm, isn't right.
Could that seem like a reward?
Exactly. That could reinforce the behavior. Criticizing or blaming is not the way. As I mentioned before, it's not something they want to do. They can't handle the overwhelming emotions and impulses. They often ask, why is self-harm bad? Seeing the blood calms me? So why is it considered bad?
Self-harm itself is damaging to the body, and it's hard to do it without causing significant harm. It's like a gateway. Severe self-harm can eventually cross an irreversible line.
Even if it doesn't lead to suicide, it's a form of self-destruction. It could lead to excessive drinking or drug use, which are also self-destructive behaviors. That's what I think, as a non-expert.
Both of you mentioned similar ideas. Right now, the self-harm might be under control and not life-threatening. It might seem like a quick solution for stress or negative feelings, but it's only temporary, not a real fix. The concerning part is that even minor self-harm scars can leave lasting marks. Some people self-harm on the elbow where it's less visible to others, but they can still see it themselves. Seeing these scars can trigger flashbacks of bad memories, known as the flashbacks in psychiatry.
It's like imprinting those memories onto your body.
So when you see the scars, those negative memories and emotions can resurface, causing you to relive those feelings even when the situation isn't currently as bad. It's like creating your own trauma. You may have done something worse, but it can lead into greater trauma. The core issue is the depression, anxiety, and difficulty you're experiencing. Self-harming is just a momentary escape, but to truly resolve those feelings, professional treatment or counseling is necessary. Repeated self-harm without addressing these issues is just a temporary fix.
When you start treatment, do they generally respond well?
Find the cause, as we said. If there's derealization, treatment targets that. If depression or anxiety is the cause, it's treated accordingly. If interpersonal or parent issues are involved, they're addressed. Self-harm can result from various stoner causes.
It's a symptom.
It can be a symptom, though many might find it hard. When it comes to self-harm impulses, some people say that if they can just get past that peak moment, they feel a bit relieved. Consulting with doctors can help you find ways to overcome and endure those urges tailored to you. So, if you're experiencing this, it might be good to seek professional advice. Self-harm isn't about doing something wrong or committing a crime, and some people, because they're struggling, families should not find self-harm too strange or criticize it, and individuals shouldn't blame themselves either. Instead, since it's a condition that requires medical counseling or treatment, I hope you go to the hospital for counseling. Okay, understood. Thank you. Thank you.